My name is Dr. Martin Daly. I'm a rural general practitioner in Ballygar in County Galway. I'm married, I have 4 children, married to Mary, my wife, who's a partner in my practice. I went to school in Ballygar National School and Cistercian College Rossgrey and the Royal College of Surgeons in Ireland in Stephen's Green. I've been involved in representative politics for 20 years now at 2 levels. One, advocating for better health services for people who live in rural areas, but also in deprived areas and specific groups such as people with disability, people who had difficulty accessing both health and educational services in rural and deprived urban areas. I also have been involved in representative politics for my profession at very many different levels, both at hospital board levels, regional levels, and task force, including task force on suicide, on rural health, on women's health, and also the National Primary Care Strategy task force in 2005. I see myself as an independent voice who will be able to give my experience as a rural GP at the coalface, demonstrating the problems people in rural areas who are dependent upon public health services, so the oldest, the sickest and the poorest, who really have no other choice but to access their healthcare needs and their educational needs through the public services. The state has pursued a policy of centralisation, and many people have found that they have been promised better services in bigger centres, most especially in health and education, but when they go there the capacity hasn't been developed. And so the state has a big job to do to convince people that there is a better way of doing things, and I want to be a voice for those people. I would lobby all parties and anyone who has influence to improve the access to public health services and education services in rural areas. I want to bring realism into the debate. I work at the coalface. I'm a rural general practitioner. We look after the least well off in our society, the people who have least access to high quality health services. I call not for the abolition of the HSE, but for a fundamental reform on how services are delivered both in the community and in hospital. These people are waiting on long wait lists just to get a diagnosis, and then when we get a diagnosis they end up in a queue for treatment. Our colleagues in the hospital understand this too well, and we have been trying to work together locally and regionally to improve that access to diagnostics. As a senator in the Seanad, I would seek that there would be a greater investment in public health services to the benefit of the whole population, because this impacts not just on people who are dependent on public health services, but also on people who are taxpayers and may well in time need those health services themselves as they get older.